everyone, I'm Shatana Nicholas and I'm going to be giving an informative speech about depression. According to our World in Data, in 2017, 792 million people live with a mental health disorder. Here I have a chart of people around the world with depressive disorder. In this first column, I have 1.8% of people with no symptoms. And then in the second one, I have 1.24% of people with all these symptoms, which are psychomotor retardation, psychomotor agitation, self-blame, weight problems, appetite problems, loss of interest, sadness, loss of energy, concentration problems, and insomnia. And I think this chart is very important because it just shows how common depression is around the world. So what is depression? So depression is a common and serious medical illness that negatively affects how you feel, think, or act. Symptoms must last at least 2 weeks and must represent in your previous level of functioning for a diagnosis. Symptoms might be feeling sad or having depressed mood, loss of interest in activities that you once enjoyed, trouble sleeping, changes in appetite, and the list goes on. But it is treatable. There are treatments, and I'm going to be talking about those later. So how do you know if you have depression? It's an illness affecting both the mind and the body. Everyone's different, so while one person could have one symptom, the other person could have multiple. So here are a list of symptoms of depression. Persistent, sad, anxious, or empty feelings, feelings of hopelessness and or pessimism, feelings of guilt, worthlessness, and or helplessness, irritability, loss of interest in activities, and the list goes on. So what causes depression? It's a combination of things. It could be genetic, psychological, and environmental factors go into development of depressive disorders. Some causes might include abuse, age, conflict, death or loss of a loved one, gender, genes, major events, and other personal problems. Like I said, there are treatments for depression, and the first one I'm going to be talking about are antidepressants. Different people respond to different treatments. So with antidepressants, it can alter the brain chemistry in your head, and that is used to treat depressive disorders. And here I have just a few of antidepressants. The first ones are SSRIs, which is serotonin reuptake inhibitors. The second one is SNRIs, which is serotonin noradrenaline reuptake inhibitors, and NASSAs, which is noradrenaline and specific serotonergic antidepressants. But the most commonly used antidepressants are SSRIs because it has fewer side effects than the other medications. So with SSRIs, the most commonly used SSRI is called fluoxetine, which is also known as Prozac. With these antidepressants, it depends on the medication, and some may take up to a few weeks, but it can take up to 6 weeks or longer to become fully effective. And then the second treatment that I'm going to be talking about is psychotherapy. With medication and psychotherapy, patients usually do both, then combine both of those to result in higher improvement rates. I listed 2 different types of psychotherapy. The first one is CBT, which is cognitive behavioral therapy. It helps individual self-defeating beliefs and patterns, and then replace them with things like exercising, doing activities to reduce stress, getting more sleep, and improve social supports. And then the second one is IPT, which is interpersonal psychotherapy, and it's focused more on interpersonal relationships and life events, and using coping mechanisms to help you. But it is important to discuss with your doctor first to see what the best treatment is for you, because everyone is different and everyone reacts to different treatments. help is available. So here I added the suicide hotline, which is 800-273-8255, and then the second one, which I'm very excited about, is the 3-digit dialing code that routes callers to the National Suicide Prevention, which is 988. But with depression being common, I think it's important to know the symptoms and causes and the signs, and getting the treatments and knowing different types of treatments to help you. And then here is my reference list.